Yesterday, posterior triangle. So in front of the sternocleidomastoid, whatever area we have, that is anterior triangle. Okay. So we will see the boundaries and contents of anterior triangle, and also we will see subdivisions. Because posterior triangle was already asked, so we can't say there may be an expectation of anterior triangle to be an essay this time. So we will see the boundaries and subdivisions. So this is the side of the neck. So we have already finished this as posterior triangle, and this triangle we will do today in detail, that is anterior triangle. So right in front of the sternocleidomastoid, this is the midline of the neck. So this is the midline which is moving from symphysis menti, the line is going to suprasternal notch. So whatever area you have in front of the sternocleidomastoid, this is nothing but anterior triangle. Okay. So sternocleidomastoid is the landmark in front of which we have anterior triangle, behind which we have posterior triangle. Okay. Then so now the superior boundary of this anterior triangle is formed by what is this particular point of the mandible? That is the lower border or the inferior border of the mandible, and this area is ramus of the mandible. This is ramus of the mandible, and this is inferior border of the mandible. So now see, this is the apex of the anterior triangle, which is situated at jugular notch of the manubrium. Now see here, this you can see the outline. Now this muscle we already know that is sternocleidomastoid. So this is the inferior border of the mandible. Okay. And this is the anterior line which is passing from the symphysis menti. This is the symphysis menti line, symphysis menti to suprasternal notch. It goes like this. Okay. So the base of the triangle is this, and the apex of the triangle is this. That means the meeting point of the sternocleidomastoid with the suprasternal notch, also called as jugular notch. So that is the apex. Okay. Now yesterday when I was discussing, I told you the roof of the posterior triangle, what muscle did we see? We saw platysma, isn't it? We saw skin, superficial fascia, and platysma muscle. Here also we are going to see the same thing. Okay. Then so now see, here we have certain subdivisions in the anterior triangle. You are finding this muscle. This muscle is nothing but digastric muscle. We have anterior belly of digastric, we have posterior belly of digastric. Okay. Along with that, we have a muscle called as stylohyoid. Yesterday we saw inferior belly of omohyoid was dividing the posterior triangle into subclavian and the occipital triangle. So if it is inferior belly of omohyoid, then this is the superior belly of omohyoid. So superior belly of omohyoid, anterior belly of digastric, posterior belly of digastric will divide this triangle, anterior triangle, into 3.5 triangles. Okay. So what are those 3.5 triangles? So this is one triangle which is named as carotid triangle. Between the two bellies of digastric, you use the word like digastric triangle, okay, or submandibular triangle, another name. Now below the hyoid bone, so here you will have all ribbon muscles of the neck. This area is called as muscular triangle, and right in front of, like below the chin, exactly this point, you call it as submental triangle. So submental triangle will be only half. So like that, we will have 3.5 triangles. I'm repeating the names. We have carotid triangle. Okay, we have digastric triangle, we have muscular triangle, and then we have submental triangle. So 1, 2, 3.5 triangles are the subdivisions of anterior triangle. We are going to discuss each triangle in detail now. Okay. Now this is Vishram Singh's picture, which most of you must be having. You can follow the same thing. See, sternocleidomastoid muscle, posterior belly of digastric, superior belly of omohyoid. Between these three, you are finding carotid triangle. In front of the anterior belly of omohyoid, we are finding muscular triangle. Okay, below the chin, exactly this symphysis menti region, here we have submental triangle, and that is only half. I'll show you with the better picture as we proceed. Now between the anterior and posterior belly of digastrics, whatever area we have, this is digastric triangle. Okay. Now see here, This landmark is the sternocleidomastoid muscle. In front of sternocleidomastoid, we have anterior triangle. Behind sternocleidomastoid, we have posterior triangle. The further subdivisions of this anterior triangle are muscular, carotid, digastric, which is also called as submandibular, and submental triangle. Okay. Now, different pictures are shown to make you understand, but the concept remains the same. So this is a digastric triangle. Okay, and number 2 area is carotid triangle. Okay, number 3 area is muscular triangle, and this number 4 area is submental triangle. Okay, like that we have 4 triangles which are the subdivisions of anterior triangle. So this picture I kept in the PowerPoint of yesterday also, to show you like how the fascia of the thoracic region and neck region are continuous with each other, isn't it? So when you have to imagine as though you are doing dissection. So first layer you come across is skin. Just below the skin you will have superficial fascia, within which you have a subcutaneous muscle, that is platysma. So platysma was forming the roof of posterior triangle. The same platysma is also forming the roof of anterior triangle as well. Okay. So about origin, insertion, nerve supply, action of platysma also we have discussed yesterday. I told you the continuation of this platysma in the face, it interlaces with the muscle fibers of rhizorius. Okay. So this picture we did, this is the third day we are seeing the same picture. Okay. So what are the things you find here? We are finding, this is the transverse section of the neck. So in the transverse section of the neck we are finding two tubes. One is trachea and this is the esophagus. This section has been taken at the level of seventh cervical vertebra. Okay, so in this transverse section we are finding in front of trachea and esophagus, this is thyroid gland. Right in front of the thyroid gland we have certain muscles of the neck region. This bulky muscle you find here is sternocleidomastoid. Below this, we have strap muscles of the neck. Those are sternohyoid, sternothyroid, and omohyoid. Sternothyroid, sternohyoid, omohyoid muscles. Okay. Now, on the posterolateral aspect of this thyroid gland, you are finding carotid sheath with its contents. Okay. So, what are the contents? Anybody remembers? Medially, we have common carotid artery. Laterally, we have internal jugular vein. Posteriorly, we have vagus. This is completely carotid sheath. Anteriorly, we will have ansa cervicalis. This fascia is prevertebral fascia, which is shown in orange color in this picture. So, behind prevertebral fascia are the vertebral muscles. Okay. So this red in color, whatever fascia you are finding, this red fascia is investing layer of deep cervical fascia. This investing layer is actually splitting to enclose sternocleidomastoid and trapezius muscles. Okay. Surrounding the thyroid gland, we have pretracheal fascia. Behind the esophagus, we have buccopharyngeal fascia, and more behind you will have pharyngobasilar fascia. So the names of deep fascia of neck also I have just introduced. Once that question comes, we will take it as an essay question. So this red in color, this is the investing layer of deep cervical fascia. Around the thyroid gland, we have pretracheal fascia. Behind this esophagus, we have buccopharyngeal fascia. More behind, we have pharyngobasilar fascia. Orange in color, we have is prevertebral fascia. Prevertebral fascia. Okay. Then now, to know the names of these muscles are very important now, because they make the anterior relations of thyroid gland. You can see the outline of thyroid gland here. And also they are the contents of the muscular triangle, what we see as one of the component of anterior triangle. What are these muscles which we should know? See, this is clavicle bone. This is the sternum bone, manubrium part of the sternum. So from here you are finding to the hyoid bone, you have a muscle called as sternohyoid. That means the starting point is sternum and the ending point is hyoid bone. That's how it has been named as sternohyoid. If you just cut this sternohyoid, below sternohyoid you have a muscle. We have cut sternohyoid here. So you are finding sternothyroid. This thing is the thyroid cartilage. From the sternum to the thyroid cartilage, we have sternothyroid. From the thyroid cartilage to the hyoid bone, we have thyrohyoid. So these three muscles are actually called as ribbon muscles, also called as strap muscles. Okay. So what are the muscles we have? See, sternohyoid is the first muscle. Below that we have sternothyroid, and below that we have thyrohyoid. Okay, these are the three muscles we see in the muscular triangle, which is one of the components of anterior triangle. Okay, because this picture is very good, I will also now introduce you to the other muscles of the neck. Above, suprahyoid muscles are these muscles, infrahyoid muscles are these muscles. Below hyoid, you call them as infrahyoid. Above hyoid, we call them as suprahyoid muscles. So what are the muscles we see? This is anterior belly of digastric, posterior belly of digastric. Along with posterior belly of digastric, you are finding stylohyoid. So these are the boundaries of digastric triangle, anterior boundary and posterior boundary. The floor of this digastric triangle is formed by one muscle which looks as though you have opened one book. Okay, open page of the book. Okay, this is the center of the book, and this muscle is mylohyoid. Okay, so mylohyoid muscle. Now, suprahyoid, above hyoid, these are the muscles what we see. Digastric, posterior belly of digastric and stylohyoid are side by side. Okay, mylohyoid is seen as floor muscle. Okay, geniohyoid is not seen here, but deeper inside, in different pictures, I will show you geniohyoid as well. Below hyoid, the infrahyoid group of muscles are the sternothyroid, then sternohyoid, thyrohyoid, and this is the omohyoid. This is inferior belly of omohyoid. This is superior belly of omohyoid. Okay, this is the pulley in between. Okay, then so this is mylohyoid muscle. See, this is actually hyoid bone, and this is the mandible bone. Extending between the mandible and hyoid, we have geniohyoid muscles. Okay. Now this picture also gives us a clear-cut idea. Just a minute. Now see here, you have muscular triangle. So the muscular triangle, I said, what are the boundaries, like whatever strap muscles just now we saw, those are all muscles what we see in the muscular triangle. Now what are the boundaries, let us see in muscular triangle. This picture has been taken in from the front beta. That means you are finding half of anterior triangle here and half of anterior triangle here. So this dotted line, whatever we are finding here, is the anterior median line of the neck. Exactly what I am scrolling in my body. Symphysis menti to the suprasternal notch. Okay, so this is the midline. So from this point to right in front of the sternocleidomastoid, whatever triangle we have is the anterior triangle, isn't it? Now when you talk about the muscular triangle, see, this is the anterior boundary. So anterior boundary of this triangle is the anterior midline of the neck. Then so laterally it is bounded by superior belly of omohyoid. Okay, so what are the, see here, muscular triangle. So this point is the muscular triangle where I kept my arrow. Okay, so this is muscular triangle. So anteriorly, this is the midline where I was scrolling my finger, midline of the neck. Then superiorly, this muscle. What is this? Superior belly of omohyoid. Inferiorly, which muscle is this? This whole thing we know. See, lower one third of the sternocleidomastoid. So this triangular space, whatever we are finding, is muscular triangle. Okay, so what are the muscles we have in the muscular triangle? Just now I already have shown you all these muscles. What are those? We have sternohyoid, then superior belly of omohyoid. This is sternohyoid, this is superior belly of omohyoid. If you cut these muscles, we have sternothyroid and thyrohyoid. Okay, so these are the muscles. So many pictures I kept. So this is sternohyoid. Okay, then this is the superior belly of omohyoid. If you cut these muscles, then we have sternothyroid, then we have thyrohyoid muscles. Okay, so that is muscular triangle. So the floor of muscular triangle, how do we see floor? You need to cut all these muscles. In the roof, you have to cut the investing layer, you have to cut the sternohyoid, sternothyroid, thyrohyoid. Once you cut all these things, you will see like in the floor surrounding this thyroid gland. What is the name of the fascia? I said in the transfer section picture, I said this is pretracheal fascia. Okay, so in the floor we find infrahyoid part of the median region of the neck. That means so many structures we find in the muscular triangle. We find thyrohyoid membrane. This is the thyrohyoid membrane. That means between the thyroid cartilage and hyoid bone there is a green membrane. You call this membrane as thyrohyoid membrane. So in the floor we also see this cartilage, that is thyroid cartilage. Okay, then we have cricothyroid ligament. That means between the cricoid and the thyroid there is a ligament. Between the cricoid cartilage and the thyroid cartilage there is a ligament. You call it as cricothyroid ligament. This I told you when we were doing larynx, in fact. Okay, so this is the cricoid cartilage which is labeled as white here. Okay, then so whatever rings you are finding below as we proceed, these are the tracheal rings. Okay, then structures in front of the trachea, you are finding this vein. What is this midline vein you are finding? So you are finding like jugular vein, isn't it? Then you are finding inferior thyroid veins. Okay, jugular venous arch, inferior thyroid vein, and this is the isthmus of thyroid gland. Right lobe of thyroid gland, left lobe of thyroid gland, midline connection is isthmus. So all these structures, they will be seen as floor contents in the muscular triangle. Okay, so these are the structures in floor. Then so floor has been like a roof has been dissected stepwise. Skin is removed, superficial investing layer is removed, platysma muscle is removed, sternohyoid is removed. Then you are finding sternothyroid, thyrohyoid. If you are cutting that, you are finding the lobes of thyroid gland, isn't it? This is the thyroid cartilage. This is thyrohyoid membrane. This is the cricothyroid ligament and membrane, isn't it? This is the isthmus of the thyroid gland. These are the inferior thyroid veins. Okay, jugular venous arch. Whatever structures which were listed as the floor contents, two pictures I gave so as to make you understand very clearly. Okay, then now any muscle can come as origin insertion. Not to take the risk, I'm giving you the details of all muscles. So infrahyoid group of muscles, so below the hyoid bone. So what are the muscles we have? Sternohyoid, this muscle. See, don't try to mug up the things. The name of the muscle only will indicate you the origin insertion. So it is coming from the sternum and getting inserted into hyoid bone. At least if you write that, you will get some marks. To be more specific, this like sternohyoid, in the sense it is coming from the posterior aspect of the manubrium sterni, sternum bone, posterior aspect of this manubrium part of the sternum, and then it is going to the hyoid bone. Okay, action of this sternohyoid muscle is it is depressing the hyoid bone. This hyoid bone is coming down by the pull of this muscle. Then next we have omohyoid. This is the superior belly of omohyoid we see here. We have inferior belly, what we saw yesterday in the posterior triangle. So insertion is actually this intermediate tendon. Okay, so which is attached to the clavicle. So the superior belly and inferior belly, both of them, they come to this pulley which is getting attached to the which bone is this? Clavicle. Clavicle. Okay. Action of this omohyoid muscle is to depress the hyoid bone. Both are depressing. Then once you remove the sternohyoid, we will see the deeper muscles. No, if you remove these muscles, we will see thyrohyoid. That means from the thyroid cartilage to the hyoid bone. Oblique line of the thyroid cartilage, it comes and it gets inserted to the hyoid bone. It also depresses the hyoid. Infrahyoid, they all depress only. Okay. So they also elevate the larynx. Then sternothyroid, from the sternum to the thyroid. Back of the manubrium of the sternum, oblique line of the thyroid cartilage is the insertion. It depresses the larynx. Okay. So infrahyoid muscles. We are going to study a structure called as ansa cervicalis. So ansa cervicalis itself can be a 3 marks question. We will see ansa cervicalis as a component in the anterior wall of carotid sheath. What is carotid sheath? I told you. Surrounding the common carotid artery and internal jugular vein, there is a covering. This protective covering is nothing but carotid sheath. And in the anterior wall of carotid sheath, we have ansa cervicalis. Okay. So infrahyoid group of muscles, whatever we saw now, sternothyroid, thyrohyoid, superior belly of omohyoid, all these are supplied by ansa cervicalis. I want everyone to practice this diagram for ansa cervicalis. Ansa means loop, necklace. This loop is present in front of the neck. That's why you call it as ansa cervicalis. Okay. All muscles of infrahyoid group. Okay. They are supplied by ansa cervicalis. Now, how is this ansa cervicalis formed? Now, let us see. I'm teaching all short notes also simultaneously so that you don't panic if such questions come. So we have cervical plexus, isn't it? That like root value is C1, C2 and C3. So this first cervical nerve is joining the last cranial nerve, that is hypoglossal. 12th cranial nerve is hypoglossal, which is joined by first cervical spinal nerve. Okay, and these two, when they join, see here, they are supplying the muscles of tongue, they are supplying geniohyoid, thyrohyoid. Okay, now the C1 is coming like this. This is called as descendants hypoglossy. C2, C3 are joining and they are coming downwards like this. Okay, descendants cervices. Okay, both of them, they are forming a necklace. It is something like a necklace what we wear in the neck region. Okay, girls. Okay, so it looks like a necklace. That's the reason it is called as ansa cervicalis. So which is descending branch of C1 and descending branch of C2, C3. They join to form this ansa. So you see this is the upper root and this is the lower root, and you can see all the muscles like superior belly of omohyoid, nerve to sternothyroid, sternohyoid and inferior belly of omohyoid. Everything is being supplied by ansa cervicalis now. Okay. Now see, this is our anterior triangle. Okay, this is our muscular component of the anterior triangle. This is our carotid sheath, which is hidden. If you remove this carotid sheath, you will see the structures, common carotid artery, internal jugular vein, isn't it? So the structures have been dissected very neatly here, isn't it? All muscles of the neck are cut. Sternothyroid, sternohyoid, thyrohyoid, superior belly of omohyoid, all cut. So what are you finding? Carotid sheath is also opened. So what are we finding? Common carotid artery, internal jugular vein. We are finding thyroid gland, right and left lobe, isthmus, isn't it? Pyramidal lobe. So like that, you can see this is arch of aorta, this is right and left brachiocephalic veins which join to form the superior vena cava. Okay, I'm trying to give maximum information from whichever diagram I'm getting so that you understand relations properly. You need not imagine things. Okay, so this is our thyroid gland, right, left lobe and isthmus. Okay, so these are the tracheal rings. This is cricoid cartilage, thyroid cartilage, hyoid bone. Between the thyroid cartilage and cricoid cartilage, or hyoid bone, we have thyrohyoid membrane. Okay, so we are done with muscular triangle. Once we are done with muscular triangle, we will try to see below the chin, mentum, there is one more triangle. You call it as submental triangle. We will see the boundaries and contents. I told you in each anterior triangle, we will see only half of it. 3.5 triangles. Muscular is complete triangle. Other muscular is also a complete triangle. Half of it, because that means 3, 1, 2, 3, only half. This sky blue color dotted line is showing only half on one side, half on the other side. Now let us see the boundaries of the submental triangle. So if you consider this as a triangle, so how is the base formed? Which bone is forming the base? Hyoid bone. So how is the apex formed? So apex is you are finding the anterior belly of digastric and anterior belly of digastric. That means anterior belly of digastric of right side and anterior belly of digastric of left side. That meeting point what we have is the apex. Okay, so this is base and this is apex. So half of the triangle is seen on the right side and half of the triangle is seen on the left side. So that is the submental triangle. Okay. Now, so apex is the lower border of the symphysis menti, what you can see here. Base is the body of the hyoid bone, and sides you can see this is anterior belly of digastric. This is also anterior belly of digastric. So what is the floor muscle? Open page book I said, right? That floor muscle is mylohyoid. Okay, that is mylohyoid. So, submental triangle, like in the submental triangle, we have lymph nodes, contents. So, submental triangle can come as a 3 marks or 5 marks question separately. So, submental triangle, what do we see there? We will see submental lymph nodes and then we will see anterior jugular vein. The link may go in less than 1 minute. I will resend the link. All of you join fast. Don't make me call you all, please. Okay, so in the submental triangle, we will see the submental group of lymph nodes. Okay. So it's better I will give you a new link for a digastric triangle. Okay, I'm stopping you.